Helen Jones to move the motion.
Thank you, Sir Edward. It's a great pleasure to be here under your chairmanship and to see so many colleagues here for this debate on funding for research into brain tumours, the first report of the new Petitions Select Committee. We began this inquiry in response to a petition started by Maria Lester, whose brother, Stephen Ralph, died following a brain tumour. And it is fair to say, I think my colleagues would agree, that we began it in a state of ignorance. We did not know a great deal about brain tumours or their impact. But as we proceeded with the inquiry, we were both humbled and shocked. We were humbled by the people who came forward to give evidence to us, whether it was in person, in writing, or on the web. And it was a measure of the interest in this topic that we received over 1,100 posts on our web thread in 10 days. All of those people had been either directly or indirectly affected by brain tumour and wanted to use their experience to improve the chances of other people. But we were also shocked. We were shocked at the number of life years lost to this dreadful disease, and at the impact on children, and at the pitifully small amount of research funding which is devoted to it. And for that reason, we have made our report slightly different from some select committee reports. There are many individual stories in it. There are pictures of those affected. And that is because we wanted to make it clear that this is not just a matter of statistics. There are real lives, real people, real families affected by this, and they are let down at almost every stage of the process, because despite the excellent work of the doctors in this area, this system is underfunded and not properly structured, and has been so for years. It is our collective failure, because this has gone on under different governments. And yet, despite its neglect, brain tumours are the biggest cause of cancer in children and in the under 40s. They account for between 15 and 25% of cancers in the under 25s. And if you look at the statistics overall for all age groups, about 60% of cancers involve the brain at some stage, meaning there has to be treatment for that if people are to recover. So the number of life years lost to this cancer, because of the age groups which are generally affected, is greater than for any other cancer. And of course, when children are involved, it is particularly tragic. We had a number of parents who came forward to tell us about what had happened to their children. A number of those children suffered from a type of tumour called diffuse intrinsic pontine glioma, DIPG. It is almost universally fatal, and a child is diagnosed with it every 9 days in this country, yet few people have even heard of it. And I suggest that if they had, there would be much more pressure to increase funding for research in this area. But for those who survive too, whether they are children or adults, there is a huge burden of this disease. Many survive with serious disabilities, physical disabilities, or other things like memory loss, personality change, cognitive disorders. And it is because of that huge burden of the disease, both in terms of life years lost and significant disabilities among those who survive, that we have made the recommendations we have. And we believe that it is time for a step change in how we deal with this most awful cancer.